Let's also take a look at some of the hazy skies over in Duluth, Minnesota this morning. Another area we watch closely thanks to the wildfire smoke coming in from Canada. It's affecting air quality that we have been talking about. And if you're not cautious and you're out there, it could actually have some health impacts.
Yeah, here to give us better insight into the health impact from wildfire smoke is Dr. Roger Kim from the University of Pennsylvania. Dr. Kim, thank you so much for joining us here on Fox Weather.
Happy to be here.
So obviously, you're going outside, you can tell that it is smoky,
Yeah.
You can feel the tickle in the back of your throat. So how can people keep themselves safe when we have so much smoke in the atmosphere?
Yeah, it's a great question. So I think the biggest thing is what you've already been referencing, which is really to keep a close eye on that AQI, that air quality index. That's a composite measurement of sort of all the different pollutants that can be associated with wildfires and other types of air pollution. These are things that measure particulate matter, ground ozone levels, carbon monoxide levels, and things like that. And it's really a very nice validated measure that is meant to help keep people safe. So really keeping a close eye on that measurement. And as you were pointing out earlier, you have those different levels, the good, moderate, unhealthy for sensitive groups, unhealthy, and then very unhealthy or hazardous, and really using that as a guide to kind of dictate what, kind of activities you should be doing and where you should be spending your time. When it does get into the higher levels, that's really when people should really start trying to take shelter indoors if possible, as long as you have the ability to have, filtered air coming through and, hopefully an HVAC system set up. That's really the recommendation.
Yeah, and doctor, it's summertime, right? And people want to enjoy the summer, but you may not even see how it is affecting the inside of your body. Can you kind of explain that a bit? Because you may feel symptoms, but not really know what's going on.
Yeah, that's right. There's ongoing research trying to figure out exactly how the mechanism works as far as, which parts of the air pollution actually can, affect your bodies. But what we do know from epidemiologic data is that it has been linked, worse air quality levels are linked to increased hospitalizations for cardiovascular diseases. So things like strokes, heart attacks, blood pressure related exacerbations, respiratory diseases. So folks with COPD or chronic obstructive pulmonary disease or asthma, we know that folks with those conditions have an increased rate of having exacerbations and hospitalizations when the air quality is worse. And also folks with chronic kidney disease, which may not be the first thing that some folks may think of. We also know that it's been linked with having worsening kidney function as well.
Now, for all the worry warts out there, because I can find myself in that category sometimes, how long lasting is the impact? I mean, if you're exposed to some smoke, and we have a couple smoky weeks during summer, is it that big of a deal, or is this something that can lead to long-term effects?
That's a really great question. We don't actually know what the exact kind of minimum threshold is that someone needs to kind of develop some of these poor outcomes. But what we do know is moderate exposure, so cumulative exposure over the course of, let's say, 2-3 months, if you're having, repeated exposure to this, we actually do know that long term, that actually is associated with kind of worse outcomes. And these are things like those exacerbations of heart disease, lung disease, kidney disease that we already talked about, but also things like actually cancer development, believe it or not. So brain cancer and lung cancer specifically, we're talking about, on the order of months to years now of kind of repeated exposure. And, with the kind of worsening intensity and frequency of these large-scale wildfires that we've been seeing across North America over the past, 2 decades, that is obviously becoming a bigger concern among both, clinicians and researchers alike.
Yeah, and it's really affecting so much of the country. We really felt it out west with fires, and now it's all over the country. You talk about real quick, I know we talk long-term, but short-term, is there something that we should look for? And at what point do we say, oh, maybe I should call my physician and check in?
Yeah, so I would say, just using your best judgment. If you're starting to feel, worsening symptoms, if you already have a chronic condition, for example, things like high blood pressure, things like heart disease, coronary artery disease, COPD, asthma, things like that, if you're starting to see some of the signs and symptoms of maybe having worsening of your baseline symptoms, or you think you're having an exacerbation, I would definitely recommend reaching out to your physician or seeking care at urgent care or even the emergency department. You know your body the best, and that's kind of what I tell all my patients as well. There's sort of no other, specific kind of, I guess, trigger that I would recommend that folks look for, other than keeping an eye on that AQI, like we talked about, and just being cognizant that if you are starting to, feel some worsening of symptoms in the setting of being exposed to worsening air quality, that might be a trigger to seek some help.
Great conversation.
Dr. Kim, thank you so much for spending some time with us, shedding some light on the situation. We hope you have a great day.
My pleasure. Thanks, you too.